Hello guys, welcome to our channel. Today we are going to discuss about the microbiology rapid revision program. So Merry Christmas to everyone. In this our mission 200 plus. Remember our 1 month, one plan, one goal is just to score the 200 plus in the upcoming Fmge examination. So as part of that, today we are going to revise the microbiology rapid revision. Only the most high yield topics and the pre-weighties. So let's start the session. So here we can see the most important from the beginning we have seen every introduction that we easily understand what is the difference between the gram positive and what is the difference between the gram negative. So the first thing that you have to know about the gram positive is that it is going to be the when you gram stain this one, you are going to see the purple and blue color. Okay, whereas the gram negative, you are when you do this, it is going to come in the pink color after the gram stain. Okay, next coming to the peptidoglycan. Here you can see this peptidoglycan is very thick, guys, in the gram positive. Okay, peptidoglycan is thick. In the gram negative, it is thin. And lipopolysaccharide layer. Here you can see this lipopolysaccharide layer is present in the gram negative. It does not present in the gram positive. So, okay. And also here the lipid content in the gram negative is more, so that's why it will cause the resistance, and also it will cause the barrier for the uh, gram negative bacteria to more adhere to our structures and the internal tissues. Okay, this is the main difference that you have to see. Okay, first thing. Next, moving on to here the picture of the bacterial cell and their how they are going to like stay in our body with this cycle. Okay, they are the four phases, guys. First phase is the lag phase. Okay, there is no increase in the number of the living cells or nothing. Next, log phase. In the log phase, they going to increase in the number. Okay, in the log phase they are increasing in the number. That's why there is a rise in the graph. Okay, next, the stationary phase. Stationary phase is only for the S for stationary, S for spore. Okay, remember this way: S for stationary, S for spore. So what does they do? The living bacterial rate of the cell division and the death are almost equal. So indirectly they are going to give birth, and at the same time they are going to be the death. So both are equal in the stationary phase. It's like a plateau phase. Both are equal. It is going to be the plateau phase. Next, death and the decline phase. When there is a decreased number of the living cells, which will cause the decline in this one. Next, there are some questions when we can do the gram stain. Best stain for the gram stain, which phase? So gram stain, if you want to do, the best phase is the log phase. Okay, because they are going to be the increasing in the number, you are going to see the whatever it is present. Okay, and also in the log phase only, we are going to see this exponential growth. That's why. All right, next, coming to the exotoxin and the endotoxin. And coming to the exotoxin, endotoxin, guys, there are the two different kinds. Okay, exotoxins are secreted by both gram positive and gram negative. Okay, but endotoxins are most commonly gram negative, and there is no here it is contains the protein as a toxin, and the endotoxins contains the lipids as toxins. Okay, lipids as toxins. So lipopolysaccharides will help them for the toxin formations, and this is outside cell wall, and it will be internally in the cell, internally in the cell wall. All right, next, heat sensitive and the heat stable. This is heat sensitive and it is heat stable. So this is the difference between the exotoxins and the endotoxins. Next, mechanisms of the different toxins that we have to take note. Okay, first, with the help of the protein synthesis, what are the organisms that is carry this protein synthesis? That is diphtheria, pseudomonas, shigella, and hemorrhagic E. coli. Okay, hemorrhagic E. coli. All these are going to be the protein synthesis. Okay, for the diphtheria, elongation factor 2, And for the Pseudomonas and the Shigella, it is 60S ribosomes. And this one, Shiga-like toxin. Shiga-like toxin. Okay. Next, neurotoxins. We also have the neurotoxins, Clostridium tetani, of course, Clostridium botulinum. Next, CAMP inducers. These CAMP inducers are cholera, right? GM1 ganglioside. This is also asked PYT for us. Next, we also have the anthrax, toxic E. coli, and pertussis. Okay, these are going to be the CAMP inducers for the toxins. Next, moving on to the motility, guys. Okay, this question can be also asked for us. Next, what is the motility? First, the way of formation and the way of moving, that is what motility of each and every organism, there is a specific. And for that, if we see the listeria is going to have the tumbling motility. Okay, next one, mycoplasma, gliding motility, and proteus, this is going to have the swarming motility. Okay, this is going to have the swarming motility. Next, cholera will have the darting motility. Clostridium, all the Clostridium species will also have the swarming motility. Next is spirochetes, cause of the syphilis. This is going to have the corkscrew motility. Okay, corkscrew motility. Next, Giardia lambia. This one will have the falling leaf motility. Even in the structure also you are going to see it is going to have the falling leaf motility. Okay, next, Vibrio cholera, that is already discussed, that is the darting motility. So these are the motilities that you have to remember for the examination. Next, okay, next, sterilization, disinfection. We have the two types of the sterilization. One is the physical methods and another one is the chemical methods. Okay, and in the physical methods it is also again subdivided for the heat, radiation, and everything, that is separate only. Okay, what are the examples? Heat, radiation. Okay, hot air oven. Okay, all these will be coming under the physical methods. Next, autoclave is also one of the physical method. And next, even radiation also, in the radiation, ionizing radiation, cold sterilization, all this will be coming under the physical. What about the chemical methods? What are the liquids that we use commonly? Isopropyl alcohol, right, we commonly use, and aldehydes like formaldehyde, this one is also used, and halogens, chlorine, all this will be coming under the chemical methods. Next, we most probably and the most importantly, what we have to remember is the what is the control of this sterilization techniques. Okay, hot air oven. This hot air oven will be at 160 degrees for 2 hours. Okay, 2 hours. What is the control for this hot air oven? Is the Clostridium tetani. Okay, Clostridium tetani and Bacillus subtilis. Okay, next one, autoclave at the 121 degrees for 15 minutes. Okay, for 15 minutes. For the 15 minutes of the 121 degrees Celsius into the 15 minutes autoclave. What is the control for the hot oven? This is Bacillus stereo thermophilus. Okay, thermophilus for the autoclave. Next, coming to the plasma sterilization. Plasma sterilization. Same, this is also going to be the Bacillus stereothermophilus. Okay, that is for the plasma sterilization. Next, ethylene oxide. Ethylene oxide. This is going to have the Bacillus globigi. Bacillus globigi. Okay, these are the important things that you have to remember for the some of the sterilization and the disinfection. Okay, next also formaldehyde. Formaldehyde used for what? Formaldehyde we usually use for the fumigation of the operation theater instruments. Okay, fumigation of the operation theaters and also some of the samples we are going to use for the formaldehyde. Next, isopropyl alcohol, you all know, like stethoscope, clinical thermometers and all. Next, radiation, especially X-ray or the gamma rays. These are used for the syringes, sutures like catgut suture, okay, gloves and also swabs. All this will be used for the X-ray and the gamma rays. Next, ethylene oxide. Okay, ethylene oxide, all the heat sensitive. Ethylene is used for the all the heat sensitive. For example, petri dishes and again syringes, dental and respiratory equipment. Okay, these are used by the ethylene oxide. Next, here the picture, this is how we are going to do the gram stain. What is the gram stain major process you have to remember here is the what are the steps. In the first step we are going to add the primary stain, that is the crystal violet, and followed by the step 2 we are going to add the mordant. This will makes the dye less soluble and adhere to the cell walls, that is iodine. And step 3 we are going to use the decolorizer, and this will going to wash out and we can see what is the gram positive or the gram negative. And this we are going to use the alcohol. Next one, we are going to last step where we are going to add the counter stain, that is safranin. Commonly we use, that is for the step 4. So step 1 primary stain, step 2 mordant, and step 3 we are going to use the alcohol for the decolorization, and the step 4 is for the counter stain safranin. Okay, this is how we are going to use. Next, we also have to know about the what are the gram positive cocci and what are the gram negative cocci. We all know, right? Cocci is circular and bacilli is rod shaped. Okay, in the cocci we have the two types again, gram positive and gram negative. The gram positive cocci are most commonly your staph cocci and also streptococcus and the staphylococcus. Okay, next in the gram positive, in the gram negative cocci is going to be the Neisseria species. All the Neisseria species will come under the gram negative cocci. Next, gram positive bacilli. Gram positive bacilli or the actinomyces. Okay, actinomyces, bacilli, clostridium, diphtheria, listeria, nocardia, and mycobacteria. These are like, remember this way: A for actinomyces, B for the bacillus, C for the clostridium, D for the diphtheria, and all by the alphabetical order: L for the listeria, N for nocardia, M for mycobacteria. Next, gram negative, all the enterobacteria, all the enterobacteria and the pseudomonas. Okay, these are the examples for the gram negative bacillus. Okay, again remember the color for this. Always the gram positive color will be blue or the purple. Gram negative, there will be pink color. Next, moving on to the agars and their types. We cultures, media, everything that we are going to discuss here. So first one is the simple media. Okay, simple is nothing but it is a nutrient media. Commonly we use for the E. coli detection. Okay, next one, enrichment. Enriched media. Here you are going to have the blood agar and the chocolate agar and also egg media. Okay, egg media. For the blood agar, it's subdivided. Again, we are going to discuss alpha, beta, and gamma. For the chocolate, we use for the hemophilus. Okay, hemophilus. And the egg media is for the cornybacterium. Okay, next one. Third one is the enrichment media. Third one is the enrichment media. And here we have the examples for the selenite for the salmonella, and alkaline, this is for the cholera. Next, selective media is a solid type, guys, and in this we remember the common one, Lowersten. Okay, Lowersten media, this is for the TB, right? Thayer Martin for the again for the gonococcus, and TCBS for the Vibrio, and cetrimide for the Pseudomonas. Cetrimide for the Pseudomonas. Next, differential media. We also have the differential media, and differential media will be like clade media. This is for the UTA, commonly we use, and the TCBS again here. This is for the sucrose and all, again cholera. Next, McConkey, E. coli and other species we are going to see, right? Next, we also have the sixth one, transport media. Okay, transport media. Here, Carey Blair media we are going to use for the Vibrio and also Shigella. And this is also our Indian, the Venkataraman Ramakrishnan. This is also for the cholera only, right? These all are the different types of the cultures and medias that we are going to use. And some other questions also can be asked here again. Alpha, beta, gamma. Alpha, beta, gamma, these are going to be the different types, guys. So alpha will going to give the green color, and beta is clear and transparent, and gamma is no change. Okay, what about the example? Why these colors are different? Alpha hemolysis is actually due to green because partially only hemoglobin that is partially hemolyzed, and beta is completely hemolyzed and there is no hemolysis happened in the gamma. Next, what are the examples? For the alpha hemolysis, we have the streptococcus, okay, streptococci pneumoniae and the streptococcus viridans. And next one, beta hemolysis, the streptococcus pyogenes and streptococcus agalactiae, and also staph aureus. Gamma hemolysis, this is for the enterococcus and streptococcus bovis. These are for this one. Next, chocolate medium. Again, this is for the Haemophilus. And the Thermartin, this is for the Neisseria. Okay, these are the important things. And some other, you can remember the base agar. The base agar is used for the Legionella. Okay, next PPLO agar. This is used for the Mycoplasma. Next, Loeffler's slop. This is used for the diphtheria. And Robertson cooked medium. Robertson cooked medium is used for the Clostridium. Right? These are the some points that you have to remember for the cultures, medias, and their examples. Okay. Next, moving on to the bacteriology. In the bacteriology, here you can see the complete classification. So when we divide the cocci into the aerobic type, we have the two types, Streptococcus and the Staphylococcus. And again, after that, you are going to subdivide the Streptococcus into the three types with the blood agar, that is alpha hemolysis, beta hemolysis, and the no hemolysis, that is the gamma hemolysis. Again, partial hemolysis of the alpha will going to be tested by the opticin. After the opticin is positive for the Streptococcus pneumoniae and opticin is negative for the viridans, Streptococcus viridans. Next, beta hemolysis tested with the B for beta and B for the bastyracin. And bastyracin is positive for the Streptococcus pyogenes and negative for the Streptococcus agalactiae. Next, gamma hemolysis, we are going to only check with the NaCl 6.5%. And if it is positive, this is the enterococci. If it is non-positive, Streptococcus bovis. This is for the entire Streptococcus. How these Streptococcus and the Staphylococcus is divided with the help of catalase. If the catalase positive is for the Staphylococcus, and if it is catalase negative, then it is for the Streptococci. Next, Staphylococcus is subdivided with the help of the coagulase. Coagulase is positive for the Staphylococcus aureus. Coagulase is negative for the both these one. How we are going to check again? Novi biosine. Novi biosine is going to be sensitive for the Staphylococcus saprophyticus and Staphylococcus epidermidis. Okay, this is the main classification that you have to remember for the both types of the gram positive bacteria. Okay, let's start with the Streptococcus pyogenes. Okay, Streptococcus pyogenes. This is the most common cause for the pharyngitis and also impetigo. We discussed cellulitis and necrotizing fasciitis. And if it is progressed, what is the complication that we are going to see? Post-streptococcal glomerular nephritis and also rheumatic fever. Right? These are going to be caused by the Streptococcus pyogenes. Staph aureus is commonly seen with the skin infections and also abscesses where Staph aureus is commonly seen, and all the Staph aureus is mostly hospital associated pneumonia and also endocarditis, post-op infections, and also toxic shock syndrome. Right, these are common with the Staph aureus. Next, Streptococcus pneumoniae is commonly seen with the pneumonia, most common cause for the pneumonia, and also meningitis. For this both one, the most common cause will be the Streptococcus pneumonia only, and also otitis media. Right, these are the common one. Next, what is this picture, guys? This is the classical picture of the Bacillus anthracis, the whatever the anthrax bacteria is going to cause. There is a two types. One is the cutaneous type and other one is the pulmonary type. Okay, so the cutaneous is going to cause this black issue. Okay, this is also known as a Hyde-Porter's disease. Next, pulmonary. This is known for the pneumonia, which will be also known as a Wool-Sorter's disease. Wool-Sorter's disease. It is going to be the hemorrhagic pneumonia in the patient. So this is what I am discussing, the black Isher cutaneous type. What are the things that you have to remember about the anthrax? It is a bioterrorism agent, bioterrorism category A. Okay, and this is going to form the capsules, and this is going to be formed by the capsules on gram stain. On the gram stain, you are going to see this as a bamboo stick appearance, and on the agar plate you are going to see this as a medusa head colony, medusa head colony, right? And these all are very important points. And next, moving on to the clostridium species. Two types. One is the Clostridium botulism. Okay. And another one is the Clostridium tetani. Let's see the differences, guys. So this is the picture of the botulism in the neonate or the infant that we are seeing here. So Clostridium botulism is going to be most commonly used in the PE. It is going to cause the flaccid paralysis. Okay, flaccid paralysis. Why this flaccid paralysis is occurring is because it is going to block the acetylcholine release. It is going to stop the acetylcholine release. Usually this is caused due to unhealthy honey or the canned foods in the children. Okay, that's why the patient will be over the time will be having this flaccid paralysis, and if it is progressed, that even it can cause the respiratory paralysis. Immediately the death can be seen in this patient. Next, Clostridium tetani, it is opposite to that. It is due to spastic paralysis. Okay, why this spastic paralysis? Because there it is going to block the GABA and also glycine. These both release will be stopped in the CNS with the help of the titanospasmin. Titanospasmin. This toxin is going to inhibit the release of the GABA and the glycine. So that's why the spasticity, uncontrolled, the muscle spasms, all the respiratory laryngospasm will be occurring. Again, due to respiratory spasm. Okay, this is spasm. The patient is going to die. And here in the botulism, the treatment will be botulinum toxin. We can give for this patient. Same as here, the treatment will be TT toxide and also metronidazole drug of the choice can be given. Metronidazole drug can be given for this patient. This is the major difference between the Clostridium botulinum, Clostridium tetani, guys. Okay, remember this one. Next, moving on to the another Clostridium species disease. This is the Clostridium perfringens. Okay, so this is going to cause the gas gangrene. In this picture also here you can see this is uncontrolled gas gangrene and progressive gas gangrene that we are seeing here. And how can you remember the important 5 point? This one, Clostridium tetani, NTR. What is mean by the NTR? This is going to be form the Nagler's reaction positive and target hemolysis on the agar plate we are going to see, and also reverse camp test is positive. So remember this way for the Clostridium perfringens cause of the gas gangrene. Before we end this, we also see the Clostridium difficile. Okay, this is the different species, one of that difficile. So this is going to be caused due to use of the antibiotics. Uncontrolled or the unreserved antibiotics, irresponsible use of the antibiotics is caused by the Clostridium difficile infection. What happens here? Pseudomembranous colitis is seen in these patients. What is the drug of the choice for this patient? We can go for the metronidazole. If it is not controlled, then go for the vancomycin. and end we are going to start this patient on the fidaxomicin. Okay, fidaxomicin is the drug of the choice, but early and the first choice will be the metronidazole and the vancomycin. Here comes the Corynebacterium diphtheriae. Corynebacterium diphtheriae. These patients will be having the classically the pseudomembranous dirty pseudomembrane on the tongue we are going to see, right? And what we have discussed, it will be having the elongation factor 2 positive, right? And also one thing that you have to remember, the most common cause for the most common cause of the death in these patients is going to be due to the toxin only. This elongation factor 2 is going to cause the toxin, that will be toxin mediated death is common with the patients of the diphtheria. Okay, next other points that you have to remember, this is looking like a Chinese letter pattern, right? Chinese letter appearance is seen of the diphtheria especially. And we also have the other types of the test and the stain specifically used for the Corynebacterium. Before that we have discussed already Kleb-Loeffler slop. Kleb-Loeffler slop is positive for the diphtheria. And along with that, Albert stain. Okay, Albert stain or the Ponder stain or the Neisser. All this will be positive for the Corynebacterium diphtheria. And what they are going to show in the positivity, they are going to show the positivity of the granules, or the polar bodies is going to be the positive in the Corynebacterium diphtheria. And we also discussed it just now, right? The Loeffler sputum positive is also going to be seen here. And toxin, how we are going to see? The toxin is positives in the Elks media. Okay, Elks media or the Elks test, where we are going to see the positive of this disease. And next, coming to the another important table, scrub typhus infections and different types of the typhus and the rickettsia species diseases. So in this, you have to remember the most commonly scrub typhus, guys. What is the species that is going to cause the disease? Orencia susugumasi. And what is the vector that is causing? Mite. And next one, Rocky Mountain spotted fever. This is going to caused by the rickettsia rickettsiae. And this is by the vector of the tick. With the help of the ticks, it is going to transmit to us. And next, rickettsia typhi, it is due to murine typhus disease, and most commonly the vector will be flea. And rickettsia prowazaki, it is epidemic typhus caused by the lice. At least these four is very important for the examination that you have to remember. And next, Q fever. The Q fever, the rickettsia australis, again it is caused by the tick. Next, moving on to the E. coli. E. coli and classes. So first, this table is very important. The enterotoxicogenic. This is known for the traveler's disease. This is known for the traveler's diarrhea. And what are the virulence that is very important here? The CGMP and CAMP. These two second messengers are going to cause the virulence in our body. Okay, next one. Moving on to the enteroinvasive. This enteroinvasive is going to cause the dysentery. Okay, dysentery type of the diarrhea, and it will invade. The name itself tells it is invasive. It is going to involve the colon. It is going to completely invade our colon and can cause dysentery, where we are going to see blood and also pus. Shigella like toxin that is going to perform. Next, enteropathogenic. This is commonly seen in the infantile diarrhea. And what we are going to see, it is going to attach an effacement in the intestinal mucosa that we are going to see, and no toxin that is present here. Next, enteroaggregative. Enteroaggregative, it is commonly seen with the immunocompromised. Immunocompromised, when we say the patients, those who are suffering from the HIV or AIDS, these patients that we are going to see. Aggregative adherents are going to be seen in this patient. Next, enterohemorrhagic type. This is going to be the bloody diarrhea, and commonly we are going to see this the Shiga like toxin. We discussed about Shiga like toxin, and what else it is going to see? Most commonly, this is going to be the species are O157H7. This is the common one for the enterohemorrhagic E. coli. And if it is progressed, it can cause the hemolytic uremic syndrome. Hemolytic uremic syndrome, kidney disease can be caused by this enterohemorrhagic E. coli. And next, what is this one, guys? This is the positive for the which condition? This is seen in the patients of the Haemophilus influenza. Okay, Haemophilus influenza, right? This is going to cause the pneumonia, again otitis media, and also epiglottitis. Okay, epiglottitis is also caused by the Haemophilus influenza. And next one, another picture. Here you can see this is the Pseudomonas, right? Pseudomonas. And Pseudomonas is positive for the all the deadly diseases that is caused by the Pseudomonas infections only, right? This is what we are going to see. Classically, this is known as a satellitism. Satellitism. What is the specialty of the Haemophilus influenza is it has the two factors. One is the factor 5, and another one is the factor 10. Okay, factor 5 is for the NAD, niacin mediator, and factor 10 is for the hemin. So these both will help the Haemophilus influenza for growth. That is what the Haemophilus influenza positive that we are going to see. Next, Pseudomonas, all the deadly infections and all that going to be the green color only. Citramide agar is positive for this, and the drug of the choice for the Pseudomonas is the piperacillin. Okay, piperacillin is going to be the positive that can evade this Pseudomonas infection. And another points that you can remember, some of the important things here is the what are the other conditions that we can list here. Listeria is going to be the commonly seen with the meningitis. The group of the meningitis for this patient is the old individuals or the completely less than 28 days. Neonates is going to be the positive for this one patients. And next one, Neisseria species. Neisseria meningitis and Neisseria gonorrhea. So Neisseria species, how they are going to be positive, guys? They both are going to look as the same only. Okay. First, Neisseria species will look like gram negative kidney shaped, or we can say diplococci. This is going to be seen in the Neisseria species as their morphology. But when it is comes to the difference between the Neisseria gonorrhea and the meningitis, Neisseria meningitis having the capsule. Okay, so the capsule is present for the Neisseria meningitis, and Neisseria gonorrhea they does not have the any type of the capsule. And the Neisseria meningitis is going to positive for the both the sugar fermentation, especially for the glucose and also maltose. Okay, M for the meningitis, M for the maltose. And gonorrhea is only for the gonorrhea, G for gonorrhea, and G for glucose only. It is going to be the positive. And conditions we all know the Neisseria meningitis is most commonly due to droplets, and gonorrhea is most commonly associated with the STD. Whatever the medias, both will be having the Thayer-Martin's media. Here also you are going to see the Thayer-Martin's media. Okay, and there will be no vaccination. We don't see any vaccine around the gonorrhea, but there is a vaccine that is present for the meningitis, right? Meningitis is very deadly that it can cause the even the patients can deadly die by this meningococcus infection. Next, Neisseria gonorrhea is most commonly associated with the STD. Another thing that you have to remember, it can also cause the pelvic inflammatory disease. If these both are present in the one partner, you have to treat the another partner also. That points that you have to remember for the Neisseria species, guys. Next, another points if we have to remember in the bacteriology, especially in the bacteriology, leptospira. This is the disease that is caused by the rat urine or the rat urine in the especially after the floods. If you see this condition, this is due to leptospira only. And what is that reaction that we are going to see, important point, Wales reaction we are going to see in this patient. That is for the leptospira. And next, Klebsiella. This is going to cause the red currant jelly sputum, right? Especially alcoholics. This alcoholic patient will be associated with the pneumonia, and there you are going to see the red currant jelly. You are going to see. Next, Bacillus cereus. Bacillus cereus. This Bacillus cereus is going to have the emetic toxins immediately after the, when they have the history of the fried rice. This Bacillus cereus will be affected those patients. Okay, these points at least that you have to remember for the examination. Next, moving on to the most importantly, virology. Okay, let's see the virology. And how can you remember the DNA viruses and the RNA viruses? So the first thing that you have to remember is the happy. Be happy when you are reading. Okay. So mnemonic also happy. So what are the habits for? First one, all the herpes viruses are mostly DNA viruses, and HBV, hepatitis B virus, and also A for adenovirus, P for parvo, and another P for poxovirus, and the last one is for the I. This is for the pappy. Okay, papilloma. So these are the viruses that you have to remember with the mnemonic of DNA viruses. Next, RNA viruses. All remaining except all these are going to be your others, are going to be the RNA viruses. Next, coming to the herpes. So the first thing we are going to discuss today is the herpes viruses only. So human herpes virus 1. This is subdivided into the two types, HSV1 and HSV2. Right? HSV1 is virus is going to be cause the cold sore, and the HSV2 is going to cause the below the waist. So genital regions, it is going to cause the vesicles. So where going to be the latency period? The latency period is going to be in the trigeminal ganglia, and the HSV2 is in the sacral ganglia. And this is associated with the droplets or the direct contact. This is going to be caused by the STD condition. Next, what are the meningitis that is going to cause? This can be also asked a question. So the HSV1 is going to cause the temporal encephalitis, and the HSV2, it is going to cause the Mallory's encephalitis. Mallory's encephalitis. So this is you have to remember for the HSV1 and the HSV type 2. Next, HSV3. So this HSV3 is going to be the chickenpox and the herpes zoster. And the HSV4 is going to caused by the Epstein-Barr virus, right? Epstein-Barr virus. This is causing the infectious mononucleosis. Infectious mononucleosis. Okay, other way, kissing diseases. Next, it is also going to cause the many other like malignancies like nasopharyngeal carcinoma and Burkitt's lymphoma, non-Hodgkin lymphoma, and also Hodgkin lymphoma, and many other like lymphatic carcinomas. All these are caused by the Epstein-Barr viruses. Okay. Next, herpes virus 5. This is our CMV, right? Cytomegalovirus. This cytomegalovirus can be seen in the maternal infections. Okay, deadly. Even it can cause the perinatal transmission or the breastfeeding transmission also seen with the cytomegalovirus. Next, HHV6 and the HHV7. This is going to cause the rogeola, also known as the sixth disease, and this is also going to cause the pityriasis rosacea. Next, herpes 7 8, this is going to cause the Kaposi sarcoma. It is going to cause the Kaposi sarcoma, right? Let's see here. This is the picture of the patient with the chicken pox. So in the chicken pox, you are going to see the this kind of rose petal appearance, right? Rose petal appearance, where you are going to see multiple polygonal ulcers at a time that you are going to see in the patients of the chicken pox. Next, this is the condition of the roseola, and this is the condition of the adenovirus, and this condition is known as a fifth disease. Okay, fifth disease, adenovirus. Sorry, this is the parvovirus, guys. Take note, this is the parvovirus. Slapped cheek appearance, fifth disease that is seen in this patient. Sixth disease, and roseola, that is you are going to see here. Completely from the neck to the toe, you are going to see the rash, and fever and rash subside at a time. That is the difference between the roseola and the other diseases. Next, this is the condition of the Kaposi sarcoma. Next, coming to these differences. One is the rubeola, and other one is the rubella. So what is the rubella is caused by? Rubeola it is known as a measles. General measles, it is caused by the rubeola. This is belongs to the paramyxoviridae, paramyxoviridae. And how this is going to be presented, guys? So in this picture here, again, I added that. So firstly, this patient will be having the three symptoms. One is the cough, rosa, and conjunctivitis. Along with that, fever plus rash is going to be seen in this patient. So this is for the classical presentations of the rubeola. Along with that, you are going to see this coplic spots. Okay, blue white color. Here you can see these spots are seen in the patients of the measles. These coplic spots are seen on the buccal mucosa. And rash, here you are going to see maculopapular rash. Maculopapular rash you are going to see in this patient. What are the complications? The most common complication will be pneumonia. So this can cause the cause of death in the patient. But most commonly seen is the otitis media. If they ask about the death, that is pneumonia. And if they ask most common, then it will be the patient with the otitis media. Most severe, then it is subacute. This is going to be the panencephalitis. Subacute panencephalitis, it is going to be caused. Next one, rubella. And rubella, this is due to Togaviridae family. Togaviridae family. And also how this patient is going to present it. First, they are going to present with the lymphadenopathy. This lymphadenopathy is seen in the post-auricular region and suboccipital. Classic presentation along with the rash and also fever seen in this patient. And on the soft palate, you are going to see the Forshemer spots. Forshemer spots are seen in this patient. Mild illness, but it is deadly. The patients, those who are pregnant, highly they are going to transmit the rubella syndrome. Rubella syndrome is seen, where you are going to see the rash, right? Salmon color rash you are going to see, and sensory neural hearing loss. Along with that, cardiac defect. Most commonly, patent ductus arteriosus is seen in this patient, and also glaucoma is commonly seen with the congenital rubella syndrome. This is for the rubella condition, rubella versus rubeola. And Nagayama spots, remember this, this is going to see the Nagayama spots on the hard palate. Sixth disease, that is your exanthum subtium that you are going to see. Okay, these are the important points and the diseases that you have to remember, the herpes types. Next, moving on to the hepatitis viruses. Hepatitis viruses, one point we already discussed, the DNA viral genome that is present in the hepatitis B. Next, coming to the hepatitis A, it is going to be the enteric type and the incubation period is the 15 to 45 days. Commonly, these patients does not have the chronic hepatitis. Next, hepatitis B, it is going to be the 40 to 160 days and it will cause the cancer, that is a risk of the cancer, and also liver failure, cirrhosis, chronic illness is seen, but only the chance is 10%. And how this is going to be either parental or the blood transfusion and even by the STD that is going to be the transmitted in this patient. Next, hepatitis C, same as that, parental, STD and also blood transfusion is seen in this patient. Again, but very highly the chance will be the cancer, the hepatocellular carcinoma, or the patient will be having the cirrhosis. 50% will be happened with the hepatitis C only. Next, hepatitis D virus. It is also due to parental, but it is associated with the co-infection or the super infections, especially hepatitis B virus. They are going to be the super infected. Next, hepatitis E, again it is a enteric fever, and if it is transmitted in the pregnancy patient, then it is going to be the severe type. But overall, the most common will be the hepatitis A associated with the enteric fever only. Okay, this is the table that you have to remember. Next, viral inclusion bodies. Either it is intracytoplasmic or the intranuclearic. In the intracytoplasmic, Henderson-Peterson bodies seen with the molluscum contagiosum. Negri bodies are seen with the rabies, and the Borel bodies are seen with the fall bodies, or it is also known as a yellow virus. Okay, yellow virus. Guarneri bodies are seen with the smallpox. Next, intranuclearic. Cowdery type A seen with the varicella, herpes simplex and the yellow virus. Cowdery B is seen in the poliovirus. Cowdery type B with the basophilic seen with the adenovirus and the cytomegalovirus. Here the owl's eye appearance, guys, and this is seen in the cytomegalovirus. And again, this is also owl's eye appearance, but this is known for the Redstenberg cells. Okay, Redstenberg cells. This is seen in the lymphomas. And this is your Negri bodies seen in the rabies. And this is the molluscum contagiosum, Henderson bodies. Okay, next, this is the giant or the worthy inclusion bodies seen in the measles. Okay, these are the some of the pictures commonly asked in the examination. Next, moving on to the mycology. Okay, for the mycology, only things that you have to remember is the dermatophytes and different types of the infections and their specific cells on the microscopy. So see this picture. This is, we have the three types. One is the trichophyton, microsporum and the epidermophyton. Okay, tri means it is going to involve the skin and also hair. Again, it is also going to involve the nails. All three are involved in the tri means three is going to be involved. Again, in the microsporum also skin is involved. Epidermophyton also skin is involved. And microsporum, hair is more involved, and that epidermophyton, nails is involved. Okay, these are the things, first thing that you have to remember. Next, coming to the microconidia and the macroconidia. Okay, so this is known for the macroconidia. What are the macroconidia? Pencil shaped, spindle shaped or the club shaped. Okay, so macroconidia for the trichophyton is the pencil shaped, and for the microsporum, spindle, and for the epidermophyton, club shaped. Right, first thing. Next, microconidia. Microconidia for the trichophyton will be abundant, and for the epidermophyton completely absent. In between the microsporum, only few will be present. Okay, this is the difference between the micro and the macro of these types of the diseases. Next, we also have the picture here. You can see the yeast, pseudo hyphae and also the hyphae. We have the three different. What is the yeast, guys? It is single celled. Okay, it is going to be the single celled. Example, Cryptococcus, one of it. And next, this is also look like yeast, but it is a producing the pseudo hyphae. This is seen in the Candida albicans. Okay, next, molds that is producing the hyphae. This is seen in the Rhizopus and also Aspergillus. gillus. Okay, this is the another form. Remaining all are going to be the dimorphic type of the fungi. Okay, first thing that you have to remember. Next, another one we discuss here, Taenia versicolor or the Pityriasis versicolor. Points that you have to remember here, it is going to caused by the Malassezia globosa, most common causative organism, and on the KOH mount, what we are going to see, spaghetti meatball appearance. Spaghetti meatball appearance that we are going to see this one for the patients of the Taenia versicolor. Next, this is the sporotrichosis. This condition is the sporotrichosis. Commonly, this condition is also known as a Rose Gardner disease. Rose Gardner disease. And on the histology, you are going to see the cigar or the asteroid bodies. Asteroid bodies. And this will follow the linear pattern like lymph nodes, lymph granulomatous disease. It will follow the lymph node pathway for the lesions. Another picture on the microscopy like this. Asteroid bodies are seen in the patients of the or with the patients of the sporotrichosis. Okay, next this picture, this is known as a chromoblastomycosis with the patients those who are having the history of the farmer with the barefoot guys. This is commonly associated, and this is known as a copper penny bodies. Copper penny bodies, these multiple colors are seen, and the lesions will be verrucous, warty, and cauliflower appearance. Okay, cauliflower appearance of the lesions that is seen in the chromoblastomycosis. Next, for the candida, you have to take note some of the important points such as, so candida will be shown as a pseudo hyphae we discussed here, but when you check this in the germ tube or the Reynolds phenomena, also candida will be positive. And also other tests that you have to remember, it is also positive for the Sabrod agar, where it is going to form the creamy colonies, and also it is going to be positive for the chrome agar for the differentiation of the candida you are going to see. And candida, the drug of the choice for the candida is mostly fluconazole can be given, but if it is more, it is going to be the very systemic infection, then we can go for the amphotericin B that we can choose for the treatment of the candida. Next, remember the cryptococcus. Here the cryptococcus, this will be stain that we are used for this one is the India ink. India ink, also known as negative stain that we are going to use here, and because this is contains the capsule, and most commonly this will be seen as a meningitis in the patients those who are less than as CD4 cells of the 200 in the HIV or the AIDS patient that we are going to see, the immunocompromised patients that we are going to see. So the main difference between the rhizopus and the aspergillus, this is the picture of the rhizopus guys, and this is your aspergillus. So first, both are belong to the aseptate only, but how we are going to differentiate between? So this is irregular aseptate, and this is regular. And when we going to check the degrees, it is more than 90 degrees, it is less than 45 degrees that we are going to see in this one. And there will be sporangium that is formed in the rhizopus or the mucor. Here we are going to see the conidia. This is the main difference that you have to remember. And the rhizopus and the mucor, what this is going to cause guys, it will going to cause the angio invasion or the black fungus, right? This is going to be seen in the patient. And for this one, you are going to see the pneumonia and also eye infections commonly. All this will be caused by the patients with the rhizopus. Next picture. Here you can see this is the coccidomycosis. This is coccidomycosis, systemic infection, mostly with the history of the soil. The inhalation of the soil will be the most common cause. Again, it is going to involve the pulmonary and also skin, bones, meninges also involved. On the tissue, you are going to see this kind of spirules. These kind of the spirules you are going to see. Okay, systemic infection. Next one. This is the paracoccidiomycosis. Paracoccidiomycosis. This is known for the dimorphic fungi, where it will be causing the chronic granulomas. Chronic granulomas will be affected in the body, and this is seen as a Mickey Mouse or Captain Wheel appearance. Captain Wheel appearance. This is known as a Mickey Mouse or the Captain Wheel appearance on the when we are going to see. Next, nemosis. This is known for the nemocystis, right? Nemocystis zeroense. Actually, this is not a fungi, but it is classified under the fungi only. Next, if the patient is having the less than 200 again CD4 cells or immunocompromised patients, then this nemocystis zeroense is formed in that patient. How we are going to see? These are known as a pink ball appearance. Pink ball appearance on the Gowari methionine stain. This is positive for the patients. Okay, next one. This is the another picture where you are going to see the histoplasmosis. Histoplasmosis, where on the microscopy, when you see, there will be narrow budding yeast. Narrow budding yeast with the macrospores. With the macrospore. Again, this is also dimorphic fungi. Dimorphic fungi. This is also going to involve the multiple. Here, another picture. This is known for the blastomycosis. Blastomycosis, another dimorphic fungi. From the inhalation of the spores from the soil, this is going to be transmitted. First, it is going to involve the pulmonary plus skin, and then it is going to involve the other systemic also. On the diagnosis, you are going to see the 8 shape appearances. 8 shape appearances you are going to see. Right, this is for the blastomycosis and some important points of the mycology. Next, moving on to the parasitology. So for the parasitology, the first one, the most common one, this is the Giardia lamblia. Right, this Giardia lamblia is most common parasitic infection in the intestine. Parasitic infection. What is the infective form? So the infective form for this one is the quadrinucleate cyst. Quadrinucleate cyst. Okay, foul smelling and very greasy. These kind of the diarrhea is seen in this patient. For the test, we are going to use the string test, or the also known as the entero test. Drug of the choice is the metronidazole. Next, coming to the, this is a classical picture of the trichomoniasis, vaginal infection, and question that is asked, if it is transmitted, partner should be treated. Yes, partner should be also treated. Next one. Some more points that you have to know about this one is the no cyst will be presented in the trichomonas. No cyst. The infective form will be trophozoite only. And this is the fishy odor, smell, or the greeny frothy kind of discharge will be seen in this patient. Again, the drug of the choice for this patient also metronidazole. Another point, remember this, how this is seen, guys. This is seen as a strawberry or the angry cervix. Strawberry cervix is the classical picture. Next one. And these two, this is the redweed bug and this is the sandfly, right? So let's see the what is the importance for this redweed bug and the sandfly. So redweed bug is also known as the triatom. Okay, what this is going to cause? Usually it is going to cause the trypanosoma cruzi. Okay, it is going to cause the trypanosoma cruzi. Okay, Chagas disease is the cause. Next, sandfly. This is going to cause the leishmaniasis. Leishmaniasis, visceral, all this will be caused by this one. But bites, redweed bug looks like it is a very painful, but this is going to be the painless bite. But the sandfly, you can feel the bite pain. Okay, painful bite. This is the difference. And this is very small. Looks like it is a big, but it is less than 2 mm only. And this is more than 2 centimeter for the redweed bug. And they are causes. Next, moving on to the cystosoma species. This is Mansuni and this is for the Hematobium japonicum. Okay, what about the spines? For the Mansuni, it is on the lateral side. For the Hematobium, terminal side. And this is also contains, but it is rudimentary. The transmission will be mostly due to urine or the feces. Here also urine most commonly because it is going to cause the bladder cancer also, hematobium. And the japonicum is also by the feces. Okay, first thing that you have to remember. Mansoni is mostly involved the hepatic fibrosis, whereas japonicum is also involved the hepatic plus it is also going to involve the CNS. For the transmission, hepatosplenic with the CNS transmission. Next one. Moving on to the Taenia solium and the Taenia saginata. So this is the most typical atypical seizures in the adults, which is not responding to the epileptics. This is the most common parasitic seizures. Okay, parasitic seizures. Difference between the Taenia solium and Taenia saginata, if you see. So the Taenia cilium is most likely to due to pork or the pigs, whereas Taenia saginata is by the beef or the buffalo's cows. Okay, this one. Next, what is the infective form? Both for the infective form will be cysticercosis. Okay, cysticerco, cysticercosis. Both are the infective form will be cysticercosis only. Next, how they are going to be the cause the auto infection. So auto infection, again injection of those eggs is present with the solium, but no auto infection present with the saginata. All these you have to remember. The drug of the choice for these patients is the albendazole, and which is going to cause the patient is going to progressive. This is due to Taenia solium. This is due to Taenia solium. Next, moving on to the another picture. Here you can see this is the Ascaris eggs. Okay, this is the Ascaris eggs where you are going to see fecal oral transmission, and these egg is going to be the embryonated egg is going to be the infective cause when they are transmitted from the fecal oral route. And one of the syndrome that is commonly associated with the this condition is the Loeffler syndrome. It is going to involve the lung disease. Okay, lung disease for this patient. Next one, trichomonas. Sorry, this is the trichuria. Trichuria. And this is the barrel shaped egg, right? This is the barrel shaped egg. And if it is transmitted and progressed, you are going to see the patient rectal prolapse. Again, fecal oral route. Embryonic egg is the most common transmission. Next one. Here you are going to see enterobius vermicularis, pinworms. And how this is going to transmit it, guys? From the rectal itching or the skin to skin touch and also fecal oral auto infection. All this will be seen with this patient. And what is the test that we are going to see? Cellophane test. Okay, cellophane tape test we are going to perform on the anal region. Okay, this is the D-shaped, right? These are the D-shaped eggs that you are going to see. Next one, and this fish tapeworm specifically it is going to cause by the Diphyllobothrum latum. Okay, so how this is going to be transmitted, and this is also feco-oral route, but specialty of this egg is that it is operculated egg. Okay, operculated and broader oval shaped egg that you are going to see of this particular Diphyllobothrum latum. Next, here another picture where you are going to see by the hemolepsis nana. This is the dwarf tapeworm. Okay, dwarf tapeworm, very smallest tapeworm that we are going to see, and this is also embryonic egg is going to cause the infection. This is how the Haemophilus nana egg is going to be seen as the with the central booklets that you are going to see here. And the drug of the choice for this patient is the praziquantel. Okay, next this is for the echinococcus. On the ultrasound you are going to see the water lily sign. What is the treatment for this patient? PAIR. What is meant by the PAIR? Percutaneous aspiration and irrigation, where we are going to perform for the echinococcus or the high-acidity cyst. Lung, inside the lung, they are going to cause the cyst. Also liver, it is going to cause the cyst. This is the major picture that you have to understand. Next, last but not the least, here comes the malaria. So malaria has the two types of the cycle, guys, right? One is the sexual cycle and another one is the asexual cycle. So the sexual cycle is seen in the mosquito and the asexual cycle is seen in the human, right? So what we are going to see, the first thing that we are going to see is the sexual cycle and the of the mosquitoes. What happen when they inject gametocytes? When they indigest the gametocytes, they are going to form the zygote and going to form the oocyst. When this oocyst rupture, it is going to transmit the sporozoites for the next bite of the human beings. Next, coming to the humans, asexual cycle. In this asexual cycle, what happens? They are injected by the sporozoites, right? These sporozoites will enter the liver where they are going to form the merozoites. This is pre-erythrocytic cycle. Next, after this, these merozoites will enter the RBC. Here the erythrocytic cycle will be started. Again, these erythrocytes will be forming the cyjoints, and once this cyjoints is going to rupture, again this cycle will be forming. Then and again the gametocytes will be formed. Again these gametocytes will be ingested by the mosquitoes, zygotes, oocyte. This cycle will be the vicious cycle that will be formed and continuous. Next, Plasmodium species, we have the Plasmodium vivax, Plasmodium falciparum, and Plasmodium malaria, and also Plasmodium ovale. The most common is the Plasmodium falciparum. And how this will be going to affect it? Plasmodium falciparum is going to involve the all types of the RBC. All RBC it is going to involve. And Plasmodium vivax, it is having the specially, it is going to have the relapse, and also it will involve the only young RBC. Same with the ovale also, it is going to have the relapse and young RBC is affected. Malaria is in our India, it is very going to less likely, but if it is affected, it will cause the nephrotic syndrome. Nephrotic syndrome for the patient. So this is the things that you have to remember. And also in the malaria, you have to remember the spots. What are the spots is seen? Also, you have to remember the dots and the stipplings, how they are going to present it. So Vivax, also the dots and the these one you have to remember one thing about the Vivax. He is going to show the Schiffner joints, Schiffner dots, and the falciparum is going to show the Morer's dots. Malariae is going to show the Zeeman dots, and Vivax, sorry, again, this is Ovale. Ovale is going to show the James dots. Okay, and what is the causative agent for this one, guys? Anopheles mosquito. Okay, Anopheles mosquito. So remaining other important points of the malaria and malaria treatment is discussed in the pharmacology. Malaria remaining points will be discussed in the PSM. And this is for today, and this lecture and important points have to be take note, and the MCQs should be practiced. Those who are new to this channel, please subscribe, and description in the link. Those who are interested can join the Telegram link. And until then, see you guys. Happy preparation and Merry Christmas to everyone.